welcoming you until who are here with us. We try our best to keep you in touch regularly as much as possible to tell you some updates, preparatory tips for the OSCE exam, and what are the updated messages from the Royal College, and what could be the new thing to adopt for coming exam preparation. And we are grateful that you are here with us. Almost all of you know that this is my humble introduction. Many days we are doing the same, and we are praying for the best for all of you. And I hope that my colleagues will be connected with me and interactive with me so that the class will be more fruitful. So if possible, try to be talking with us in the group. So what our topic was that how we can prepare ourselves for the next coming exam. And you know that the South Asian OSCE exam now 3 diets in a year, and the coming diet is very closer. And I believe that uh, all of you now in your regular preparatory time, you are busy, not only with the job and other family issues. Regularly, you are preparing yourself. In the meantime, what could be the tricks and tips, as is unavoidable when exam is ahead and time is very limited? We will try to give you some highlights, some important messages, what we gathered from the last exam experiences. So actually, if we like to say from our institute, this is one. Again, this institute welcome you and thanking you. This is the blueprint for the exam. I hope most of you know about that. The Royal College proposes this thing. So we will try our best to understand from this chart. And for better understanding, I just have rewritten a little with little modification. If you come back, you just see this is the list of the systems here, and this is the category. From the list, you understand there are some alternative systems to each other. So they are in the same group. Remember it. Though there are many systems, but some systems are in the same group. Can anyone say which system is missing here somehow interesting? Please, anyone, please have a look. And your response is very important to proceed further our discussion. Please. And can anyone say which system? I think the writings are visible in this chart. Anyone? Just look at the left side. In your observation, you are preparing also. Can anyone say me that this system is not there anywhere? Anyone? Please. Dr. Hannah, are you free to talk now? Dr. Hannah? Just look at the system, please.
Doctor,
Yeah,
I think
doctor.
surgery is not there.
Surgery, yeah. Usually you prepare the AKT with a headline of surgery and allied subjects, right?
Yes.
So actually surgery is not much important in the OSCE exam, the basic surgery or surgical messages. There might be some surgery in the management plan, but overall, any topics from the surgery. But if you want to say which will be the surgical topic, suppose ENT, indirectly it could be the topics from the surgery and allied subjects. Okay? So some
Yes.
touch is there, but any other observation? Any other observation? Please, anyone, very intelligent one. And we have to be very critical also. Those who are appearing the exam, please, doctor, try to practice it from today also with me. If you look at what we usually prepare by ourselves, not only the AKT, even in the skills. Yeah, Dr. Zahid, please. What you were thinking?
Psychiatry.
Psychiatry written as, no, this is psychiatry here. Neurology or psychiatry. Yes, any other one? Anyone?
Doctor, metabolic, maybe?
Metabolic can be covered under endocrine. So metabolic also not much important as individual systems having the extra glamour or individual glamour. It can come somehow in the cardiovascular medicine, endocrine disease, renal medicine. No one observing. Just let me say
Geriatric,
now.
sir? Geriatric will come with neuro?
Yeah, geriatrics. Yeah, geriatric can be under cardiology, neuro mainly. There may be under cardiology and even the urology. Suppose prostate case. Okay. No observation further?
Yes. Hello.
Pediatric, sir.
Pediatric. Fantastic. Pediatrics. That I was waiting to hear.
Okay.
Pediatrics. You see, we are sometimes
Yeah.
afraid of pediatrics, those who are not working in the pediatric field.
Yes.
And in our AKT courses also, those who attended or use the module, you know, pediatrics has a lot of informations. Even sometimes we take 2 classes of the pediatrics. So big bulk is not covered. But if you say that pediatrics individually a system, and pediatric may have cardiovascular disease, respiratory disease, in this system wise, pediatric can be covered. But pediatrics definitely has extra attention to be needed. And OB-GYN, someone said, no, doctor, men, women's health, sexual health, these are the OB-GYN. The language of family medicine is a little different. So we tried our best to make a group in this way. Now you understand. So that is our agenda today, the how to make our preparation within short period of time a better. So if we understand the Royal College proposal, if there is any gaps, we have to fill it up. This is actually, we are trying to make it up today. And you see that there we added extra headline, child diseases and miscellaneous, some other issues also may not be covered with any system. There might be some cases like that. If you come to the right side, the case categories are acute case, chronic case, psychosocial case, and the preventive case. Do you like to add any more category here as before in the system? Any colleague, please? So you were thinking that category could be more than 4. Can anyone? For example, what you were thinking, maybe like that. Please be connected. Please be connected. If I say the case of acute myocardial infarction, it could be acute case, definitely. Yeah, Dr. Zahid.
This can be the acute on chronic.
So it is acute chronic under these 2 headlines.
But sometimes somebody has a disease, is on the treatment, and there is a flare.
It could be acute or chronic. Yeah. If you say a subcategory under this acute or chronic could be acute or chronic, right?
Sir, maybe a palliative care.
Palliative care, yes, not definitely clearly mentioned here. You are right. Yes. Any other one? It just sharing each of us that our individual observation that you are preparing, you are thinking, but not mentioned directly. Dr. Hanna.
Vaccination?
It could be under preventive, doctor.
Sorry.
Yeah. So this is our today. I just to check that how our colleagues are thinking according to the category. Our focus will be today more towards the category. I like to conclude there later on. Any other? So we can say miscellaneous could be category indirectly here. It is also, you are right. Miscellaneous, though we put it here along the row of the system. Any other? Anyway, we will help, we will guide you. So before going there, let's see the last Karachi. You can remember, some of you possibly attended our Karachi just post-exam gathering over there. Many candidates, colleagues, those who passed there also, they shared their views. So actually later on, we made a search along all the cases, more than 100 cases from 6 days exam. We tried our best to make so-called post-mortem of that. What the case is actually giving us the messages. If we can absorb the messages from the cases, it will be easy for us to make a short-term preparation. I hope that you will be connected with me even in the discussion. So let me open the exam cases of day wise, just to look at from there what messages we are gaining. So I am requesting again to all of you just to be attentive. I think the font sizes are okay to view. Please again help me. Can you see the text here written? Just to show you whole 14 cases. For that, I don't like to increase the font size. Please, is it visible, legible? Yeah, again, please, can anyone help me? Dr. Hannah, Dr. Mohsen? Who can? Is the text are visible?
It's visible, clearly visible.
Okay, okay, thank you, doctor, thank you. So if you see there in the day 1, so look at Dr. Mohsin, please be connected. I admire you, I recognize you also. You are helping and connected throughout all the classes, if possible, doctor, if you have time, just to
Yes,
help.
sir.
So you see, first case was the fatty liver. What is the system?
GIT.
Indirectly. But what is the category of the case? What is the category of the case? Anyone can respond, no problem. Anyone? 1, 2, 3. If possible, if you don't have noises, be connected with me. Dr. Zahid, please. If you say, what the
Chronic.
category here?
Chronic.
Fatty liver, yes, is a chronic category, but for the exam purpose, we have to be oriented in a different category, not in the format of chronic cases. I will show you the chronic case format prepared by ourselves. So we like to say this is an investigation report discussion. Dr. Zahid, please be connected if possible. If you're not on duty or somehow connected otherwise. So it will be lab report or investigation related station. So there are some styles how to express the investigation report, how to interact with the patient. One thing. Second, come to the second one, Dr. Zahid. Gonorrhea male patient. I think all of you collected this list, but I told you it's a post-mortem of the case. Second case, what type of system? System, definitely infection or genitourinary medicine. But the gonorrhea patient male, what could be the type? Acute. Acute, right. The next one, Dr. Zahid, try to say. Gout, recurrent stone, and the toe pain.
The chronic.
You can say now again the acute and chronic. Yes. Right? That means the pain is coming in the toe, maybe the podagra. Patient actually a diagnosed case of gout, chronic gout, could be. So it is again acute or chronic category. Then 4.
Is a chronic case.
COPD, definitely chronic, name itself chronic. But can it be again acute?
It can be exacerbation.
Exacerbation could be acute, yes. Even it could be respiratory failure with, isn't that it?
It's the respiratory type 2 means.
It may be type
2 respiratory.
So again,
COPD.
Failure means the acute or emergency as well.
Yes.
Okay. And then the 5, please, Dr. Zahid, thanking you. Again, the infection gum is a lab report. Possibly rubella 24 weeks pregnant. Those who attended our OSCE courses before, I think you can remember that there was a case we discussed of the rubella. So it is pregnancy.
From the test torch. We are doing the torch for these patients. And that in that there's a rubella.
Could be the impact of rubella in the pregnancy. So in that case, the report should be understood by the doctor. There may be some positive, negative report for the antibodies to the rubella. So again, we can say this case from the investigation category or lab report category, plus again, if you tell the system, from which system, it could be infection gum, as well as it could be the system from the women's health, right? So-called OB-GYN in our general or internal medicine. But in the family medicine language, it could be women's health. Isn't that it, Dr. Zahid? Women's health.
Yes.
So
yes.
in many ways, we can categorize a case. Okay, then come to the 6.
This is JIT, or we can say ENT case also.
Yes,
because
both possible. Both possible. But we tried our best to make a, suppose if you say ENT, we accept it. We can say it is from the ENT, both GIT, ENT. So system is a mixed here, but category. Sorry, some little error. Category acute, chronic, or other.
It can be acute, it can be chronic.
How? Patient presented.
Because many people having the GERD for a long time.
The case was no, Dr. Zaid, did you attend any discussion with the previous colleagues? What happened in the last exam?
No.
No, or for that we discussed a little also. We got the messages in the last time. And those who know, you can share today here also. What was the case? The gastroesophageal reflux disease and the hoarse voice. Actually, how the case was presented in the exam? Can anybody say, remember? I can remember that the case was actually gastroesophageal reflux disease. Now patient having the hoarse voice. This is the background, but in the station possibly presenting complaint was hoarse voice. As a reason, you need to search many causes of hoarse voice, and underlying disease was gastroesophageal reflux disease. Possibly it was true. So if it is a hoarse voice, it could be acute case, right?
Yes.
If there is no gastroesophageal reflux disease, hoarse voice may be dangerous also as a presentation of the lung carcinoma. Phrenic nerve involvement could be there. Anyway, we are not discussing too much. Dr. Zahid, please be with us in the number 7. Pap smear. Again in the women's health. Okay.
Gynae.
Category. Gynae is not the category. Gynae is the system. That is a woman's. But category?
System.
I'm going back. Category means acute, chronic, psychosocial, preventive. Minimum 4. If you want to say additional category, sorry, I jumped. Again, additional category. Pap smear for what?
Pap smear to see there is no any malignancy.
But the theme of the case, underlying
acute?
Theme is preventive.
Preventive, yes.
Isn't that it? You may disagree with me, no problem.
No.
But
I'm 100% agree with you.
We like to hear. We like to hear from other colleagues what you are thinking. Please, if you don't talk, your presence today will not be much fruitful for you, doctor. Please be connected like Dr. Zahid. So it could be preventive. Now come down. Shoulder impingement. Maybe patient presented with the shoulder pain. What was the case? Could be acute, chronic, preventive, or psychosocial, or any other type you can synthesize.
It's chronic.
Chronic. Okay, number 9. Bronchial asthma, marriage after 4 months, her husband afraid about asthma. That was the flavor. And I can remember in our last courses, it was our intentional case we have given to all of the colleagues, those who participated. It never come before in the OSCE this way. So far we know that husband afraid and other. Case is chronic, but category agenda of the station is not that. It is not a clinical diagnosis of asthma simply and its management. Issue is husband is afraid about the asthma. Psychosocial rather. Psychosocial, we can say. Psychosocial. So asthma treatment, asthma disease itself and its treatment could be stigmatized in the society. That was our intention also in our classes. So though it is bronchial asthma, apparently as a disease, it is a chronic. Actually, category is not the same. Very right. Next, number 10. Peripheral neuropathy, diabetic. It is endocrine system, but category could be chronic.
Is it chronic?
Chronic. And palpitation with ECG 4 days ago done. It was diagnosed, possibly our colleague said it was supraventricular tachycardia. So in which category you put it?
Can be acute.
Can be acute, in one way acute. Another category, as I said you, that we have to prepare ourselves how to discuss investigation report. If we make another category, we can say it is investigation report. Though it is one of the bedside investigation or your chamber side investigation, I like to focus there also. We can say it is an investigation report related station. Number 12, cerebral palsy. Cerebral palsy, baby. Can we put it in a palliative one? One colleague said, maybe Dr. Mohsin or someone said, would it be in a palliative group?
Can be palliative because we have some congenital cerebral palsy.
Congenital, yeah, one flavor is there, but there is point of no return.
Palliative.
So wherever the point of no return, it could be a palliative case. Again, we categorize as a nervous system case, but we can say this is a child case also, isn't it? Pediatric case.
Yes, this is pediatric.
We can say pediatric case. In many ways, they are maybe mixed up of the systems, but category, I like to highlight it. Number 13. Post-MI advice, depression and medication, and when return to work. That is the points to be discussed with the patient, this thing. There are some other points also you can go through, you can see. So post-MI advice to the patient is very typical case and very nicely written in the book. So cardiovascular, what type of case could be?
Just psychiatry with the psychosocial.
It is not psychiatry. As you see, the depression is one of the point only. But overall, you need to talk to the patient, motivate the patient about the medication, lifestyle, and others. So we can say it could be a counseling station. If patient is refusing or not understanding something, it could be a counseling station. And just to make a follow-up, how to follow up the patient also. So follow-up is not a main category in the OSCE exam. Rather, we can say this is a counseling station could be there. That is how to explain to the patient and how to make the patient convinced to do. Now 14, TIA. What type of case it is? Apparently, it could be nervous system, or again, it could be cardiovascular also.
Nervous, cardiovascular, and
apparently
preventive.
Nervous. TIA.
Our target is preventive.
If patient presented for the next prevention, could be preventive. What type of prevention could it be if TIA diagnosed already by you? Secondary prevention.
So
secondary prevention. So it could be preventive case, or for the first case you are diagnosing, is it the challenge in the station? It depends upon. It depends upon the designing of the instruction in the exam. So it could be an acute case also, right? Suddenly weakness develop and recovered. It could be like a stroke. Stroke is not recovered. So it could be acute case. So what message in summary you can see in the system? The Royal College are, in my sense, in my observation, more attentive to the category of the cases. Patients are coming in the different ways. So our challenge now, the system or category, both are important to us for our preparation. You see that somewhere, some systems are repeated. For example, you see cardiovascular, these 11 and 13, you see, right, Dr. Zaid?
Yes.
This is, okay. And we can correlate with the TIA with the cardiovascular system also indirectly as a cause of the embolism or others. So you see the system is repeated. It means giving an importance of the system as well. That cardiovascular is number one system to be prepared. Take the message. And in our list also, we put this number one in our classes also when we do system-wise preparation. This is the reason. And other, second could be the respirology. Respirology. So is there any case double? Yes. Suppose this one respirology, this one. One from the bronchial asthma, another is the COPD. Now, how fantastically, as a case, as a disease, presentation is the breathlessness. COPD is the breathlessness with cough. Asthma also breathlessness, more or less with the cough. But main attention here, COPD is a chronic case, but the bronchial asthma is a case in a different presentation, social case, psychosocial case. So there may be you are getting the system could be common, but category will be different. That means when you prepare for the respirology, you are preparing for the acute case, you are preparing for the chronic case, you are preparing for the psychosocial case, you are preparing for the preventive case, and we develop some other additional category I will show you. So thank you, Dr. Zahid. You can take rest if you don't mind. We can invite you again. Other colleague, please, who can share with us for the next day. These are the exam. I will not talk much today about the exam. You can view our video also. Focus examination may be available in the YouTube. But if I come to the second day cases, please, anyone can help be connected just to say in this way what I discussed with Dr. Zahid. Try to storm your brain a little. I hope Dr. Hannah is here. Dr. Hannah, are you there to talk?
Yes, doctor, I'm here.
Yeah, please be with me a few minutes. We will
Yes.
not stay more as we discuss detail in the day one cases. So number one, what will be the category of this station?
Cellulitis.
Yes.
With diabetes mellitus.
Yeah, what will the category?
INF.
No. Category means you can say acute, chronic, or other. It is an acute case.
This is acute case.
Acute case. Okay. Second.
PAD.
Peripheral arterial disease. What will be?
Chronic.
Preferably chronic. Okay. Third one.
Yes. Amoebic dysentery is acute.
Acute. 4. Exercise-induced asthma.
Asthma, it could be chronic, could be acute.
Could be chronic or acute exacerbation. Okay. But could be other case also because patient is working in a bad environment. Who can say now? Who can say, including you also? Don't be disconnected, Dr. Hannah. Other colleague. Other than this, exercise-induced asthma. Suppose he's a football player, cricket player, occupational is related. Exercise is occupational related. In that case?
In that case, it will be acute.
So there may be another category also, occupation-related asthma also. No, I'm telling there could be some counseling station also. Explaining the problem and how to overcome the problem. How to do the exercise. Usually we say that take the inhaler earlier than exercise. Patient is to be convinced. A little flavor of counseling could be there in the station, even in the exam. But if occupation, it could be a pure counseling station to change the occupation and how he will earn his livelihood. There may be separate station. Okay, number 5.
Male infertility. I think this is chronic.
Chronic, yeah, could be.
Cleft palate.
Could it be? No, please. Could it be psychosocial issue, main infertility?
Yes, it could be.
Yes, good. And cleft palate.
Congenital.
Congenital, there is no group. There is no extra attention in the OSCE as a congenital action. It could be chronic. Any other type? If it is not repairable.
If it is not repairable, it will be chronic.
One type, another flavor. Mother is worried. Mother is worried.
Yeah, it will be
Nothing
preventive.
there, preventive for the future baby, but for this baby.
Yes,
For this baby,
via ultrasound during pregnancy, you mean?
could be, again, mother is anxious. Mother is psychologically depressed also.
Counseling
And
for the mother.
yeah, one is
Counseling.
the counseling. Again, it could be psychosocial also. That mother is afraid or full of shame that baby is like this. How baby will grow? If the baby is the female, what will happen in her future? Right?
Yes.
Many cases could be designed from the topic. Actually, I was not clear about from our talk in the last time. The colleague couldn't disclose all the details. Possibly, what is the internal message is given in the exam. So many ways we can categorize. Now, next one, Dr. Hannah. Pneumonia?
Pneumonia, it can be, no, it's acute.
Acute, okay. 8. We'll go through.
PID can be acute and can be chronic also, sir.
Okay, can be acute, can be chronic. 9. Next one. Quickly
Palpitation
go through.
and anxiety, it will be acute.
So it is a mental case. That means a psychological, right? Psychiatry.
Yes.
Psychiatry.
It can be also due to anemia, due to thyrotoxicosis.
But with anxiety is mentioned here, doctor, right?
With an anxiety, it will be mental, psychological.
Yeah, psychology,
yes.
Psychiatric. Okay, renal mass.
Chronic.
So it could be nephrology or maybe selected from the oncology. There was one topic, oncology. I am going back again for you. Can you see now?
Yes, acute, chronic,
yeah, endocrine. You see, endocrine and oncology is another separate category.
Yes, okay.
It means wherever the endocrine case, there may not be oncology case. Wherever the oncology case on that day, there may not be endocrine case.
I understand. Yeah.
It is not hard and fast. Suppose if I say this is oncology, can you search any endocrine case in the 14 cases on that day? Have you seen?
Depression also can be due to oncology.
No. How? It is another way. It's an possibility is there, but not a direct possibility. But I am thinking pure oncology case. Is anyone here from there? Up to 14? Please, everybody look at. Possibly no. I just like to correlate this list. Wherever endocrine, there may not be oncology case. Wherever eye case, there may not be ENT case. Or may not be even the dermatology case. Though it is not a hard and fast rule. Okay. Now come to the 11.
Low back pain.
Low back pain. Chronic.
It can be acute and chronic also.
It can be acute. Usually chronic.
Okay.
And the 12, depression with dementia. Psychiatric
Psychological.
there.
Yeah, psychiatric.
Psychiatric could be. Again, you see, there is a repetition of the system also. Right? Repetition of the system. And IBS could, or hypertension associated could be there. So far we can remember. So IBS, what type of case?
Chronic and also psychological.
We have to say psychosocial.
Psychosocial, okay.
So is not it? Patient will be embarrassed in this in the society, in the gathering. She is to or he is to go to the washroom on and off. Right? So it could be psychosocial, though systematically it is a case from the gastroenterology. Cluster headache.
Acute.
Cluster headache, acute, yeah. Recurrent headache. So now the storming done from the second. Thanking you, Dr. Hannah. May I invite anyone who is interested to say about the day 3? Other colleagues was talking, please. Anyone? Please, anyone? Can you open the mic? Anyone? Or may I invite Dr. Zahid here? If possible. From this case. Yeah. Dr. Zahid, just now fluently, we will not be staying more. Scleroderma and the Raynaud's. What type?
Chronic.
Chronic, but with the Raynaud maybe acute presentation. Raynaud maybe, and it is a recurrent rather. So more likely to say chronic. Number 2. Antenatal care. Patient is smoke. patient drink. So it's a preventive case, as well as counseling. Is that it? What do you think? As well as counseling also to avoid smoking, to avoid drinking. And the concern is the Down syndrome, right? Explanation.
Yes.
So it is a different special category also. Number 3, atrial fibrillation. Chronic.
Probably chronic. Can be acute, but probably chronic.
Chronic. Number 4.
Chronic. Parkinson's disease, chronic. Yes.
Okay. Please, you can complete it one by one, please. We are listening you. Next one. Number 6.
Psychosocial.
Please, everybody share. If you have difference of opinion, you can communicate with us, with Dr. Zahid. No problem. We are just in a group discussion. Yeah, Dr. Zahid. 5 is a chronic, but is there any other flavor?
Sir, psychosocial.
Psychosocial, how? Can you explain? Dysmorphic disorder. Yes, there is a psychological background. Maybe may not be depression. So dysmorphism, you understand? Understanding of abnormal size, shape of the body or appearance. Okay, underlying psychological abnormality, psychological understanding is there, but so it could be again psychologically. That means he or she express in the society in a different way. So it could be a psychosocial also as well. Thinking. Dr. Zaid, next. 6.
COPD, chronic.
Chronic. So now you understand the COPD exacerbation, right? See, if it is exacerbation, we can say acute or chronic or acute?
Sir, acute on chronic.
Acute on chronic. Acute on chronic. So I'm just scrolling up. In the first day, there is a COPD, right, Dr. Zahid? You can remember. We discussed with you.
Yes, first was COPD.
Again, in the third day, they have selected COPD. It means, this is a post-mortem class, I told you before. It means how COPD is important topic in the OSCE exam. Try to remember it. That means your focus, your attention will be designed from our today's discussion. How you will give more time in which system, which disease. So this will be your today take-home message. Everybody try to make your own take-home message. I will not tell. It is your duty today. So COPD. And then, doctor, I lost. Okay, 7. Tuberculosis. New tuberculosis is a diagnosis. So it's a chronic case. 8. Child ASD, congenital disease, pediatric.
Pediatric is congenital.
Yes. No, actually, in our sense, we categorize it. Okay, it is a chronic acute, but extra category we can develop other than Royal College. That is the proxy case. Proxy case. Proxy case. Proxy means patient is not there. Patient is presented by other person. Mostly the mother. Mostly the mother. So this is a proxy case. All the child cases are proxy case in the exam. So how to talk to the proxy in the exam? This is another category. This is our design, our plan. Proxy. Okay. Dr. Zaid, if you are free, continue. 9. Osteoporotic vertebral fracture, asthmatic on oral steroid. This is a drug-induced issue.
This is preventive.
Is again secondary prevention. Moreover, counseling also. Moreover, counseling also. Counseling means to stop the steroid, maybe a steroid abuser. Asthma patient will feel better with the steroid. So you have to convince the patient not to take a steroid other than doctor advice and things. So it could be again counseling. Lab report number 10, pre-diabetes.
Preventive.
So again is an investigation type. In our sense, doctor, our proposal, that means from our side, our DOAM's telling, it is a preventive case. Sorry, investigation related case.
Yes.
I will come to a conclusion later. 11, HIV. ELISA method. Again, it could be investigation related case. But if I can remember in the last time, test was negative. Now counseling could be there, right, for future. So it could be preventive case. It could be counseling related case. Right, Dr. Zaid? Dr. Zaid having some noise, please. I don't know. Can anybody take the mic? Dr. Zaid having noise. Maybe someone with you.
Okay, I will stop my. I'll mute
noise.
myself.
Yeah. If you have the noise, please. Anyone, Dr. Mohsin, please. Just to help me to continue, not to be stopped in between. Dr. Mohsin or anyone be connected. Just to finish it, doctor. It is important. Dr. Hannah, be active, please. Discussion should go on in this way, not from my side alone. Yeah.
Yes, doctor.
Yeah, thank you. So HIV already understood, and it could be counseling case, it could be lab related also, investigation related. Okay. And preventive case also, Now, 12, again the lab report, that means investigation.
Yeah, investigation.
That means fecal local blood test, FIT test, right? FIT.
Yes.
The FIT. Polycystic kidney disease. What
Chronic.
type? Chronic,
It's
right?
Chronic.
Again, there could be counseling. How? If it a polycystic kidney disease, you have to screen the family to check the brother, sisters, and others, even son, daughter, for polycystic kidney disease by ultrasound. If it is the issue, then it will be a counseling station.
Okay.
Counseling
Yeah.
station. Dequervant tenosynovitis is acute case, thyroid.
Acute.
Okay, thanking you. Now come to the next day 4.
Pregnant asthmatic.
Worry for medicine. So worry for medicine again, this case similar to that worry of the husband-wife relationship after the diagnosis. Though it may not be husband-wife issue, but worry for the medicine. Patient is reluctant to take the medicine. So again, it could be psychosocial, right? One.
Yeah.
Second thing, worried. Actually, it case, so far I understand, the impact of the medicine to the fetus. It was the issue more likely.
So again, it's preventive.
Maybe again preventive as well as rather to say counseling station. Okay, second. Fasting blood sugar and others. It could be investigation related and diabetes explanation. Maybe mixed up also, right?
Yeah.
Categorically, a station could be mixed up. 3. Nephropathy following NSAID.
This is chronic.
Chronic, okay.
Acute watery diarrhea.
Acute. And there could be again component of counseling. How to prevent the watery diarrhea, infection and other from the foodborne disease. How to prevent the foodborne disease. Angina, acute.
Angina, acute.
Tonsillitis, acute. And 7, high triglyceride.
Chronic.
As a case, chronic, but actually main flavor could be counseling. How to minimize the triglyceride level in the blood, lifestyle and others.
So it's preventive.
Okay, obstructive sleep apnea.
Chronic.
Irregular cycles.
It can be chronic, it can be acute.
Irregular cycle may be chronic problem. Few months the young lady doesn't have period or the irregular period you are talking. There might be some again worry. Psychosocial could be there. There could be some psychosocial component. Now the 10, worrying mother about 12-year child. This is a proxy case, right? Always pediatric is a proxy case. Low performance at school and home.
Preventive. Yeah.
Maybe how you are thinking it is preventive?
It is a counseling, sir.
Counseling, yes, Dr. Rubina possibly talking. It could be counseling.
Yes.
Describe with the mother how to prevent this. It could be ADHD also, right? What that? Hyperactivity disorder, right?
Autism, it will be autism.
Many other diagnoses will come out from there, but mainly could be counseling, right, Dr. Rubina? Then BPPV, ENT again. Again, someone said the geriatric case. So it could be geriatric case, but selected from ENT. Okay. BPPV. So it's a chronic case. But I told you, usually whenever there is an oblique again coming back, ENT, you see, alternate. Wherever the eye, there may not be ENT case. Okay. So you see till now, until the number, is there any eye case? No.
No.
You see up to the 14, no. So this is the post-mortem today. We are talking inner concept of Royal College strategy. This is the way to learn. So breaking bad news now, special category here. Till now on the third day, it is actually not psychological. We try to put it under miscellaneous category. I have shown you miscellaneous. And breaking bad news, definitely in any diet, there will be 1 or 2 days breaking bad news station. So we need to learn about how to break the bad news. This is very special category. This is very important part of our course also, that how to break the bad news. It is not only in the OSCE, throughout the world in any exam. Okay, and then investigation report, VDRL positive, how you are summarizing the lab report, and again, additional could be preventive as well as counseling, right?
Yes.
Okay, now gout, big 2. Again, you say gout is repeated here. The previous one could be the acute case. In this case, maybe chronic case as a chronic gout. Chronic gout. Thanking you. Dr. Hannah, are you tired? Otherwise, we can invite Dr. Rubina if you don't mind.
Yeah, sure.
Thank you. Dr. Rubina, please, can you share with us day 4, hypothyroidism?
Hypothyroidism and depression. Hypothyroidism is chronic.
Yes, usually chronic.
Yes.
Associated depression, maybe hypothyroid depression, or was the case about the diagnostic dilemma to diagnose hypothyroid or is a psychiatric depression. It may be challenge also in the exam. Anyway, whatever it is a chronic case. Second, perimenopausal.
Perimenopausal. Perimenopausal chronic GAD symptoms.
Again, psychiatric or
psychiatric.
Yes, it psychiatric. And perimenopausal may be the woman's health case.
Yes.
Again, there may be flavor of the counseling also about the perimenopause.
Yes.
It's a natural course of the life. We have to explain it. Now, number 3, infantile colic, proxy case. We have to say proxy case. We have to say apparently headline proxy case because mother will be talking. Okay?
Yes, sir.
Mother will be talking. And the BPH.
BPH.
The geriatric urology and the chronic, right? Usually chronic. Number 5 is a very interesting topic in the 5.
Yes, sir.
Pre-travel counseling. Traveling to East Africa. Now talk.
Yes.
Counseling.
Sir, counseling is simply.
Counseling, right?
Yes. Lab report, pulmonary tuberculosis. This is again counseling case.
Maybe counseling. Smear positive means isolation as there. As well as we can say chronic case. There may be part of from the counseling as well. But interesting, you see, pulmonary TB before also you have seen in the day, second day maybe tuberculosis. Again, in the another day, what is the day here? 4, there is a tuberculosis case.
Yes,
okay, repeated. Again, you see occupational asthma. We talk more about the asthma. So it is a chronic case, acute exacerbation. Again, it could be a counseling case to change the job or protection in the job place. All the time, changing the job is possible, Dr. Rubina?
So sometimes, but we can give in the...
Yeah, sometimes not possible. Suppose in the last 2 or 3 years, we are doing our job in our Corona COVID time. Could anybody change the job at that time? Everybody was to do the work in the hospital.
Yes, sir.
So sometimes it is not possible. So counseling as well as other things also will be there to discuss about.
Yes, sir.
Right. 8.
Then uncontrolled hypertension chronic with the stroke.
Oh, stroke. Okay.
Okay. And then obesity, again chronic.
The chronic, but we have to say this may be counseling. to minimize the obesity. So we put actually sometime we can say the miscellaneous case also here.
Okay, yes.
Okay. And the jaw pain, there is a diagnostic challenge. I don't know, can anybody enlighten us? What was the diagnosis, causes of the jaw pain in the exam? Can anybody say today? If you know. I'm sorry, actually I couldn't discover it from our talk before. Jaw pain,
sir, that was of trigeminal neuralgia at that time.
could be trigeminal neuralgia. It may be acute case.
Maybe acute case.
Very right, doctor. You're gazing. Thanking you. It could be, yeah. There may be some, I like to add you now. Jaw pain, there is an osteonecrosis of the jaw by the bisphosphonate. It's very rare. It's very rare.
So rare case is coming?
That I am telling. Don't think about the rare thing in the exam. First of all, think about the common thing. Okay, now 11. I'm sorry, I couldn't collect the day 4, 3 more cases. It was missing.
Genital rash is
I don't know if, please, if anybody can help me in our WhatsApp inbox, we will be grateful.
Yes, sir, I have.
Please, you will give me, not now, later on after the classes in our WhatsApp.
Yes,
in our DOAMS WhatsApp, please. I hope you can do. Additional, can you remember additional 3? You can say.
No, sir. At the moment,
okay, you can check. So number 1 is the genital rash, molluscum contagiosum and warts. Infectious disease, though, again, there may be something of the prevention also, right?
Preventive.
Could be, or counseling could be there, right? So, Dr. Rubina, we will waiting for you from this third case. Now, Dr. Rubina, can you continue the day?
Yes,
is it 5th or 4th day? 4. But I have written day 6. There was maybe exam. That one did not happen in the Friday. For that 5th day possibly was off somehow. Maybe sequence maybe a little wrong. Don't worry, no problem.
Friday and Saturday was off.
Possibly. So don't mind that his sequence is not there, but the cases are listed. So in the next day, Dr. Rubina, can you continue? Smoking in pregnancy.
Smoking in pregnancy, more is counseling case.
Counseling, definitely. Wherever the smoking, there is a counseling.
Yes.
Wherever the alcoholic, there is a counseling.
Yes, gastritis versus pancreatitis, both is acute.
Acute is a diagnostic challenge. There is a diagnostic challenge. Maybe renal colic. What do you think?
Acute. Yes.
Acute.
This is both acute.
Renal colic is an acute. Cervical spondylosis.
Chronic.
Yeah, chronic. 5. Next one.
Erectile dysfunction with the uncontrolled diabetes mellitus are chronic.
Chronic, but can we make it in a different category according to the Royal College?
With the
psychosocial doctor.
With diabetes mellitus, sir. Diabetes mellitus.
No. A special category, the psychosocial.
Okay.
Is not it? In the life, family life could be in jeopardy.
Yes.
Usually there is a component of psychosocial issue, erectile dysfunction.
Yes.
So there are some 3 components in this way. One is the erectile dysfunction in the male, another is premature ejaculation, another is the low libido. You need to prepare in this 3 headline. Diagnosis could be anyone from the 3. Okay.
Then sexually transmitted disease, trichomonas vaginalis. This is also
acute case maybe, but again the counseling. Counseling to prevent the STD.
Yes.
7
and
next.
psoriasis chronic.
Chronic. Okay. Dermatology case then.
Angina pectoris is acute.
Palliative care. I don't know what was the case. Palliative care on that day. What was the topic? But there is a categorically it was a palliative care. Maybe malignant case or terminally or advanced musculoskeletal disease, connective tissue disease was there.
Trigeminal neuralgia is acute.
Maybe repeated, as you said, the jaw pain could be trigeminal neuralgia. Here also trigeminal neuralgia. So trigeminal neuralgia, one of the common cases in the OSCE. Peripheral arterial disease. It is also repeated, right? Can you remember? It is also repeated. It's a chronic case. Again, tuberculosis. How many times repeated? Contact. Patient is in the contact case. How you
counseling case.
So it again the counseling.
Yes.
Again, I don't know how fantastic. In the same day, there is one station tuberculosis contact, another was diagnosis of pulmonary tuberculosis.
Yeah, chronic case.
No, important is that how tuberculosis is most important in the OSCE. In the same day, the same topic, not from the respirology other case. So you need to know A to Z of the tuberculosis as a GP, not in very specialist level, as a GP level, right? Okay,
Yes.
then 14, headache.
14 is pediatric with the headache. His mother abroad.
Father
That's
is abroad. Maybe tension headache in the baby.
Baby.
So it's a proxy case.
Proxy case, and that is, I think, counseling case.
Yes,
mainly.
maybe counseling case. So, Dr. Rubina, can you give a chance to other colleague, Dr. Faiza here?
Yes, sir. Sure.
But don't be disconnected. Dr. Faiza, are you ready to talk? 7-day case.
Yes.
Thanking you. Yeah, go through.
Maybe lymph nodes.
Again,
That is chronic.
so you see again in the same diet, how many times tuberculosis repeated?
For the session.
Yeah, then heart failure. Maybe acute on chronic or chronic. 19-year-old substance abuse. Counseling.
This is social.
Counseling. Psychosocial. One could be the category psychosocial, another will be counseling. So psychosocial and counseling as an allied, similar, near about, as a type of category. Then stress incontinence.
This is a chronic disease.
Chronic disease. Typhoid.
Maybe acute.
Acute fever, febrile illness. Then pregnant, blood pressure high, patient is on captopril.
This is maybe
Chronic.
acute.
Chronic. Rather to say chronic patient, actually drug is not enough. We have to modify the drug and discuss.
But we will not give captopril for pregnant lady because contraindication in
Yes,
pregnancy.
this is another way, another flavor is that counseling. We have to stop the captopril.
To secondary care,
referral needed. So if it's a counseling, actually in our courses we design under the group of miscellaneous somewhere. For that we have written miscellaneous. Okay. Next 7, abdominal pain with history of constipation. Could be intestinal obstruction and post appendicitis. Some colleague were discussing.
Maybe obstruction somewhere.
Maybe a complicated diagnosis there. In that case, GP has every opportunity to refer. So it is acute case abdominal. You can say now someone asking about the surgery case, right? So it is GIT, maybe under the headline of surgery. Okay. Surgery though less tasked, not much. 8, dizziness. ENT.
Dizziness.
ENT.
This is acute.
Dizzy may be recurrent dizziness or acute, preferably acute. Vestibular neuronitis. Number 9, costochondritis somatoform, a diagnostic challenge. Maybe psychosocial or pure psychiatric case. Not clear. Maybe upper abdominal pain, somatoform illness, maybe psychiatric or mental. Maybe again in the categorically acute could be. Costochondritis means T syndrome. Possibly you have heart T syndrome. Okay, number 10.
This infectious cough, maybe this is a chronic
problem. Yeah, chronic problem. Right. 11.
Fibromyalgia.
Or
this is also
we actually categorize in the miscellaneous in our courses fibromyalgia because this is a mixture of chronic problem, mixture of understanding means counseling. Okay, fibromyalgia is a disease of counseling. Convince the patient medication will work less, not completely, wholly. So fibromyalgia in another way, in the systematically, it may be musculoskeletal presentation. So we heard about the polymyalgia in the last time. Actually, all the investigations not in favor of polymyalgia. More likely it was a fibromyalgia. And sometimes this fibromyalgia is called technically difficult case. In other words, technically difficult case. And technically difficult case, another example is IBS also. Irritable bowel syndrome. You are facing this in our practice. So we can put it in the miscellaneous category also there. Anyway, 12, hypoglycemia on glimepiride. Again, maybe counseling. Teaching the patient to avoid the hypoglycemia, how it is possible. 13, vaccination, counseling, mother, proxy case, right? Mother not agreed. Proxy case as well as counseling.
Counseling the mother how to
Yes,
deal with
vaccination about. to make the mother convinced for the vaccination. Okay, there was our very pet case in our course. 14, gynecomastia and amitriptyline.
This
Again,
is
the drug
a
related, maybe counseling as well as a chronic case also. I can remember in our courses in the last time, there was an erectile dysfunction by the amitriptyline. We discussed. Those who attended, you can know. But here in the exam, on that day, there was a gynecomastia by the amitriptyline. That means amitriptyline, why they have chosen? What we have chosen in our course? It is just understanding that amitriptyline most commonly prescribed drug by the GP.
Yes.
So even in my practice also personally, I prefer this drug much. So we need to know about the side effect of the drug. For that, amitriptyline related side effect may be a common case in your exam. Right. So at the last part today in this list, who will continue? Dr. Faiza, possible? Can you continue?
Yes.
Okay, if you are free.
Abuse. This is a
Counseling. Abuse is
mental. This is a
counseling. Or again under the headline of psychosocial case. Headline of psychosocial case. Then headache, red flags, subarachnoid hemorrhage, acute case.
acute case.
Acute case. Then the lab report, fatty liver disease. It is a repeated. It is a repeated case, right? Maybe we discussed today. First case in the day one was the fatty liver. So it is a repeated case, really, fatty liver disease. It is a part of the metabolic syndrome. So it's a chronic case, but in our headline in category, we have to say about maybe in the lab report also. That is the investigation related. Number 4, chronic.
Nephropathy. This is a chronic disease.
Case. Again, gout repeated. Gouty arthritis. Maybe chronic, maybe acute. Epididymoorchitis.
This is acute case.
Fertility issues there. Maybe counseling. Fertility issues there. They are worried about the fertility, right? Okay, atrial fibrillation repeated. So this is again investigation related ECG. That means you need to know about the ECG. Though chronic, but ECG is important highlight here that you need to know about the ECG.
Yes, sir.
There was one case before ECG diagnosis, supraventricular tachycardia. In this ECG, there was atrial fibrillation. So ECG is repeated in the same diet. Okay, down. Lobar pneumonia is repeated case, right?
Yes.
From the
maybe acute.
Maybe acute. So it is a repeated case in the exam. But main highlight is the chest X-ray. Maybe in the one day, there was no chest X-ray. Everybody is preparing for, okay, get ready with the X-ray. Another day, there is no X-ray. The topic is same, but instruction is different. Maybe content of the instruction is different. So this is the flavor again in the OSCE case. That is the post-mortem again, I like to say today. Again, chronic bronchitis, bronchiectasis is diagnostic challenge from the X-ray. It is a chronic, but again, highlight was the X-ray. This is the investigation. Number 10, contact dermatitis. Now you came to the skin cases. So my beloved colleague today, how many skin diseases you faced in this diet? Very less.
Only one first.
Maybe only 1 or 2. In this day, there is another skin case, could be varicose vein. You see, varicose vein. I like to sum up in the skin. Initial, that is the evolution update. In the AKT, picture case was there mainly from the dermatology, right?
Yes.
And in our general practice also, skin cases are much common. But how to design in the exam skin cases? So there is no patient. And skin case is diagnosis of by looking, inspection mainly. So they are not producing those mass cases nowadays. But in our time, I can remember skin case is very common every day. They are showing the picture. Skin case of the psoriasis, skin case of other infection, fungal infection, skin case of acne. But now in the last time we observe, skin case is less. But again, reminding you, don't think that skin case will be less in future. In this exam, in the last time, skin case is less. In the coming exam diet, skin case will be more because it is important. In our practice, skin cases are common. So in the coming exam, you need to be prepared for different categories of the skin cases. Okay. 11, microcytic hypochromic anemia. Maybe lab investigation description. Concern about thalassemia. It means there may be counseling case.
Yes.
So we need to know about the genetics also here a little. Right. So varicose vein, again counseling maybe and the diagnosis, referral. Okay, could be. Palliative care, there is carcinoma breast. There was a case
Counseling.
possibly carcinoma. Again counseling. We put it under headline of the miscellaneous there. And the perimenopausal syndrome with loss of libido.
Counseling.
Counseling, it could be psychosocial issue also.
Yes, yes.
Is not it? There may be a relationship problem with the husband, wife. It is also true. So these are the cases, and all of you today understood. The category is very important here. Important here means to prepare ourselves. System case you can prepare by yourself from the books and others. But category, I think nowhere discussed even in the book, or I don't know, maybe in some courses or other mentors are allied with the category. But in our courses, we are highlighting category. And because in the station, you need to talk about the category also. Suppose this is the category, we can modify also a little here. 1, 2, 3, 4, 5, 6, 7 category we design from there. So counseling, promotive case, preventive case in the same headline. It is our arbitrarily we design. Suppose the proxy case we actually you see written here as a proxy case. In the miscellaneous group, breaking bad news, angry patient was not there in the last exam. But sometime, even the exam before this last exam, there was an angry patient. So in the coming exam, there is a chance that they can select from the angry patient or angry relative. It is a special category also. You need to learn. Ethical case and the legal cases are few, not too much. So we put it under miscellaneous here. So this is our overall category. Psychosocial already you understood. Proxy case you understood. Proxy case may be the dementia case in the neurology. Patient cannot talk. Okay, mental the memory problem. So this is the thing, doctor. Now a little look at the examiner mark sheet. Please, I am giving you a few seconds to read by yourself. I am not talking. Few seconds you just look at what are the highlighting. If you want to ask me any point from here, you can ask. You look at few seconds, doctor. I have your understanding. These are the 4 headlines of marking by the examiner. They give you this grade, excellent and other. They will give a summary of the markings. But the main points there, doctor. If you want, you can make a snapshot. We customized it with the different color for better understanding. It is also given by the Royal College. And communication skill there. Problem in question. This is called the agenda. We have to understand the agenda. We discussed there. Case is bronchial asthma, but agenda is not bronchial asthma. I think you understood what I say. And in the examination, be specific. Expected findings, you have to expect earlier. Then you have to design. It is called the focused examination. Though I didn't discuss the focused examination much, you need to learn. You need to be oriented about the focused examination in the station. So I refer you to see our YouTube video about the focused examination. Another thing, you see counseling, negotiation. It is a part of your the counseling part, negotiation and others. In the it can be part of the management as well. But in the management, we have to consider the patient's perspective. We have to say in the layman language. It is called the layman term. And how to, again, this counseling, there is a structured counseling. It is not the time to say, discuss detail to you. I said you the counseling in a special category and how to counsel a patient. So categorically, we need to learn. So again, I'm a little going back. We need to learn the 7 categories of the structure. 7 categories of the structure. It could be actually more than 7. It could be more than 7. It is a broad headline. Okay, so this is the exam mark sheet. And for example, a chronic case category that is a structured, we can modify it as an acute case also from there. So one thing you see, focused examination is a part of your skill here, focused examination. So we designed it data gathering headline, diagnosis, routine questions, problem list, and the management according to the problem list. There are many other headlines. You need to touch each and every point in the exam, in the OSCE. And in the pediatric patient, additional points could be there. P bind, all of you in the meantime, you know. In addition, P bind, we have written here P bind for the child, and the elderly patient, ID, 4 ID, iatrogenicity and other. It is a mandatory part in a geriatric patient evaluation. Who is a geriatric patient? Can anybody say? In which age we consider this is geriatric patient? We like to finish within few minutes, doctor. Please, anyone can say. In which age category we say this is geriatric? More than?
70 plus?
No, doctor. 60.
80 plus? 60 plus?
65.
In our
Yes.
South Asian perspective. But in the
Okay.
other World Health Organization, geriatric will be 85 plus, so far I can
80
remember.
plus. Yes.
But in our South Asian, we can say senior citizen means 60 years and plus. 60 years and plus. So this is our overall preparation checklist. In the history detail, how to say take the history. Actually, we discussed it in our basic course, the history and others. This is the basic headline from that. And now come to our activities to highlight for a few minutes. Please be with me. This is our basic module. Those who are using, you know, some of you. From there, we tried our best. The fundamentals of the OSCE here, 6 X-ray, ECG and others must know. But system-wise discussion in other 7 up to 24. And again, there are some category-wise video records. It is not the practice session live will be in future. This is a record actually we mentioned. Those who are using, you know, and for those who are new, for your understanding, a chronic case, acute case, there was a live case discussion interaction and correction. We recorded it. We put it in our package there. And there are many other master classes in different topics, big. It is the ECG there, even then a detailed ECG. If you are interested, you can look at. So this is actually our basic online, wherever you are, you can study it. And we give more importance there to improve your base. You need to go through such program. If you want to be allied with us, we will offer you this thing. There are 44 classes plus many master classes. So more than 44 classes are there. Minimum you need to pay 3 months time here to prepare yourself. Minimum. So you see in the future exam also you are having a little more than 3 months time. So if you want, you have to start from beginning, from today or tomorrow. This is a very basic. Plus we are going to for the category wise practice is there. For the practice, we make a combined actually pack for the preparation. This is a basic plus live category wise 35 case, and the live there will be 5 plus 5 very final preparation of the 10 cases mock from all the systems and all the categories as much as possible. If five candidates are there, there will be 50 cases. So this is our doctor, actually our humble proposal to you for guidance for the you and the coming exam. This is a complete preparation package, including the package. So if you are interested, you can communicate with us. With the few talks, doctor, we like to conclude here. But if you want to ask anything, the session is open for you for a few minutes. Please, anyone to ask from the participant. Can anybody want to discuss or share any comment? If not, we can conclude today. And especially thanking you, those who were with me actively, Dr. Hanna, Dr. Zahid, Dr. Mubina, maybe. Sorry if I am wrong, Dr. Mohsin. Dr. Faiza, Rubina, sorry, Doctor. Thanking you, Doctor. I'm sorry. And other also, I know some of you today, though you couldn't talk. to make the class fruitful. Your talking was important to make the class fruitful. And if just 1 minute, doctor, those who are not connected with us, I am giving the WhatsApp link here in the chat box directly. 1 minute, if you are interested, you can be connected with the WhatsApp. Many doctor requested us to be connected. For that, I am giving you. If you just click and enter, you will know our activities every day. We are active every day in the group. We are active in the Telegram also, but more busy with the WhatsApp. You can see there our update and anything you interact with us. And thanking you. See you. Best of luck. Thank you very much, doctor.
Thank you, sir.
Okay. Bye-bye.